After we consume a meal, particularly one high in carbohydrates, carbohydrates are broken down in the gastrointestinal tract as simple sugars, such as glucose. Glucose will enter the blood, which will increase in amount. As a result, the pancreas will release insulin, which will also go into the blood. Certain tissues in the body, such as liver, fat, and muscle, are dependent on insulin for glucose to enter. Here, the insulin will bind to the receptor and glucose will enter. In the liver, the glucose is stored as glycogen. In the fat, glucose is used for energy and stored as fat, and in the muscles, glucose is used for energy and stored as glycogen. In diabetes, we have a dysfunction of this process. In type 1 diabetes, there is a dysfunction in the pancreas, and the beta cells that produce insulin no longer make insulin. As a result, there is no insulin to allow glucose to enter these cells, therefore glucose will increase. As a result, type 1 diabetics will need artificial insulin for their treatment. In type 2 diabetes, the problem is at the receptor level, which becomes desensitized to the insulin molecule. As a result, blood sugar can't enter, glucose can't enter these cells, blood sugar levels increase. The pancreas tries to counter this by producing more insulin, but over time the pancreas becomes exhausted and can no longer produce adequate amounts of insulin. The treatment for type 2 diabetes is certain medication, such as metformin, which increases the sensitivity of the receptors for insulin, increasing the amount of glucose that can enter, or other medications that increase the production of insulin, such as sulfonylureas, or artificial insulin to increase the insulin level in the body.